Hi guys, let's talk about the pelvic bone. So the pelvic bone is the largest bone formation in our body. It articulates with the fifth lumbar above and also with the head of the left and right femur in its corresponding acetabulum. So we're going to have the head of the right femur sit in this cup-shaped depression called the acetabulum, and we're going to have the left femur also sit here as well. Now the pelvis helps transmit the weight of our trunks onto our legs. Okay, it is formed like a bony basin forming a girdle, and it provides protection to our pelvic organs such as the uterus, the ovaries, the bladder, and the lower portion of the alimentary canal. Now, the pelvis is made up of four bones, namely the sacrum. So this is the sacrum. This is the sacrum. And the coccyx, unfortunately, the coccyx is not attached here, but the coccyx is continuous or attached to the sacrum at this particular point. So together with the sacrum and coccyx, they form the posterior wall of the pelvis. And also two innominate bones. So this is one innominate bone, which is the right one, and this is what the other innominate bone. So the two innominate bone will form the anterior and lateral walls of the pelvis. Now let's look at the sacrum. When you take the sacrum is formed by fusion of what? Five sacral vertebrae. It is triangular in shape and it forms wedge between what? The two innominate bones. Okay, now where the sacral vertebrae fuses, it forms what we call the foramen. Okay, the foramen communicates with what we call the sacral canal. Through the foramen we have blood and spinal nerves, lymphatics passing through to supply the pelvic organs we have mentioned earlier on. So the spinal nerves will pass through this part, the upper part of the foramen, and opens at the fifth part. Okay, but when it gets to the second and the third, these nerves fans out, forming what we call the chorda equina. And so it is at this particular point that in labor we find some doctors introducing local anesthesia to block the nerves below the S2 downwards. So temporarily we have the nerves below the second sacral vertebrae being paralyzed, such that it helps the woman will manage her pain or prevent pain perception, even though she remains fully conscious and is able to cooperate when she has to push. I hope you get it. Yes. Now, if you look at this very well, we have the sacrum. When I turn to this back, this is rough. The back part is rough. It makes attachment for some muscles. But if you look at the inner part of the sacrum, it is smooth. It is what? Concave in nature. The concavity brings us to what we call the hollow of the sacrum, and it is concave in this manner to help increase the adequacy of the cavity of the pelvis. Are you getting it? Yes. Now when you look at it closely too, in the first or the center of the first sacral vertebrae, where it articulates with the wall, fifth lumbar, this is the cartilage, where it articulates with the fifth, like the middle part, we could see that this part what pushes out, and this is what we refer to as well the sacral promontory. And when you check on the same first sacral vertebrae, realize that the bone also fans out or spreads out like a wing, and that leads us to what we call the alley of the sacrum. Alley of the sacrum. Okay, now when we leave the sacrum, we have the coccyx, and I said it's not attached here, but coccyx is also made up of four fused bones. It is also a very tiny bone, but also triangular in shape, and the tip of the coccyx makes room for attachment of muscles and ligament. Where the coccyx joins the sacrum, the joint that it forms is flexible such that it allows the coccyx to tilt back when needed during delivery. Okay, now we come to the innominate bones. Our focus now is on the innominate bones. So in an adult, we find the innominate bone as one large irregular bone, as you can see on this one. very large and irregular. But until one is 25 years, this is not how it is. It's not completely ossified, but it's formed or made up of bones that develop from what three main ossification centers. And these parts are called the ischium, the ilium, and the pubis. Now, if you look at this one, look at this particular acetabulum. So this particular part upwards, all these parts upwards, from this part upwards is what we call the ilium. Okay, then from this part to this part is known as what? The ischium. The ischium. And from this part throughout this one is known as the pubis. The pubis. The pubis. So when you take the ilium, so the ilium is the upper flat part portion. You could see the ilium makes up the upper 2/5 of the acetabulum. Okay, upper 2/5 of the acetabulum. When you look at it closely, the ilium has an inner surface which is curved. It is concave in shape, very smooth and curved, concave in shape, and this is called the iliac fossa. Now this iliac fossa makes attachment for what we call the iliacus muscles. When we turn to the back of the ilium, we could see that this particular part is irregular and rough, and this makes attachment for the gluteus muscles of the buttocks. Now back to the ilium. The ilium is surmounted with what we call the iliac crest on this top, and we can easily palpate the iliac crest when we hold our waist. That bony prominence we feel is the iliac crest. Now the iliac crest terminates anteriorly into what we call the anterior superior iliac spine, and so this is it. Then approximately 2.5 centimeters below, we have the anterior inferior iliac spine. Okay, then when I turn it posteriorly, the iliac crest terminates in what we call the posterior superior iliac spine. Okay, and the landmark for the posterior superior iliac spine is the two dimples at our back, at the upper parts of the cleft of our buttocks. The upper part, there are some dimples. That's the landmark of this posterior superior iliac spine. Then just below it, we have the word posterior inferior iliac spine, which marks the border of the wall greater sciatic notch. So this is the greater sciatic notch. Greater sciatic notch. Now the greater sciatic notch provides attachment or passageway for the sciatic nerves. I hope you get that portion. Sciatic nerves. Okay, now when we leave the ilium, we come to the ischium. So this is the ischium. This part is the ischium. Now the ischium makes the lowest part of the innominate bone. It forms lower 2/5 of the acetabulum, and this is it. Now the ilium has what we call the ischial tuberosity, which is the body of the ischium, and this is the dense part, the ischial tuberosities, and this is the part that we sit on when we sit down. So these are the ischial tuberosities. Now approximately 2.5 centimeters above the ischial tuberosities, we have what we call the ischial spines. The ischial spines, the ischial spine, ischial tuberosity, ischial spines. Okay, now the ischial spines divides the greater sciatic notch and the lesser sciatic notch, the ischial spines. Then we'll come to what we call the pubis. Now when you take the pubis makes what the lowest or the smallest part of the innominate bone. It makes the lower 1/5 of the acetabulum. So this portion is the pubis. Now the pubic is joined together. The body part is joined together by a cartilage which is approximately 4 centimeters anteriorly. Okay, now in the square shape area, the pubic bone unite together. Then we will see that when you leave the pubic body, just above it, we have what we call the superior pubic ramus. The superior pubic ramus, then it extends to join the ilium at what we call the iliopectineal eminence. The pubic bone extends from its superior pubic ramus to join the ilium at where we call the iliopectineal eminence. This protrusion here, iliopectineal eminence. Okay, now when you come down here, we have the inferior pubic ramus. These are the inferior pubic ramus. The inferior pubic ramus also joins to the ischium at this particular point. It unites with what? The ischium at this particular point. The two inferior pubic ramus also forms what we call the pubic arc. The pubic arc. The pubic arc. Okay, so thank you for watching. This is the pelvis. Stay tuned, we will bring more. We will go and talk about the pelvic joint. We'll talk about the pelvic floor muscles. Remember to like, comment, share, and subscribe. Bye.